you know that in Major League Baseball, players are only allowed 3 days off for maternity leave? We all know that parents play a big role in our lives, whether it be positively or negatively. But how much of an impact do they make when we are infants? We generally think that mothers make a bigger impact when we are born, but fathers can make just as big of an impact by taking maternity leave. There are many benefits by fathers taking maternity leave. Some of these benefits are improving the development of the child, creating a lasting bond between the father and child, and helping a mother to avoid experiencing postpartum depression. The first reason fathers should take paternity leave is to improve the development of the child. Most fathers do not take paternity leave because they feel it is not essential to the health of the child. However, that is not true at all. According to Anna Mansdaughter, a father's close involvement and interaction with their child improves the intellectual, social, and emotional development for the child. Fathers may think their own involvement is not significant when their child is an infant, but that is when the child needs their father the most. When the father is absent, it puts the child at risk for negative outcomes in virtually every area, according to Carrie Adamson of the University of Connecticut. If a father decides to take paternity leave, how long would the father take off of work? A couple of days or maybe a week? This is not long enough for the father or the child. Fathers who take a longer paternity leave tend to become more committed to take care of the child later on. According to Lena Nepomazzi, an associate research scientist at Columbia University, and Jane Waldvogel, a professor at Columbia University, when fathers take a leave of 2 weeks or more after their child is born, they are much more likely to engage in child care tasks. Indisputably, a couple of days or a week are better than none at all, but the longer the paternity leave, the more positive impact it'll make for the whole family. Most fathers do not receive pay while they take off for paternity leave. This could result in the father feeling obligated to work more, which would cause less family time spent with the father and child. The less time a father spends with the mother and child, the more distant the bond between the whole family becomes. Although taking paternity leave could reduce the family income, the development and future of the child is more important than a couple of days without pay. The second reason fathers should take paternity leave is to create a lasting bond between the father and child. A father can either play an active or inactive part in their child's life, depending on the interaction with the child. Children need their fathers throughout their whole lives. If fathers want to be a part of their child's life, they will find a way to do it. There is no acceptable excuse to not be a part of their child's life if they are physically and emotionally capable of doing so. Although it is true that a relationship can begin at any time in the child's and father's lives, if that relationship is not started at infancy, it is very likely to harm the child for the rest of his or her life. According to Paul Ramahachian, fathers who are not an active part of their child's life by as early as 3 months old corresponds with early behavioral problems in the child. By creating a close bond when the child is an infant, the more likely the father and child will have a close bond in the future. The last reason we should encourage fathers to take paternity leave is to help the mother to avoid experiencing postpartum depression. Paternity leave not only affects the father and child, but the mother as well. As tradition goes, mothers often take on most of the responsibilities and tasks associated with child care. However, taking on most of those responsibilities and tasks connected to caring for the child can become very overwhelming for the newly adjusting mother. Although mothers do not often admit or talk about experiencing postpartum depression, about 8 to 15 mothers go through it. According to Kathleen Berger, an expert on developmental psychology, postpartum depression is a feeling in which new mothers feel sadness and inadequacy in the days and weeks after giving birth. Postpartum depression can range from mild baby blues to severe forms like postpartum psychosis. Postpartum depression can be hard to detect in new mothers due to the various symptoms and different ways that mothers adjust to a new child. Some women cannot sleep or cannot stop worrying about their newborn. Some of these symptoms are normal, but family members, especially fathers, need to pay close attention to the mother as well as the child. Postpartum depression also negatively affects the child. Women who suffer from postpartum depression are at higher risk for smoking, alcohol abuse, physical and emotional abuse. These risks also correspond with a greater chance of mothers committing suicide. According to Elizabeth Filston, an instructor in clinical psychology, if a new mother experiences any of these risks, their child will suffer in many ways. All of these risks reduce the time spent with the child and the close bond that could have been created otherwise. In conclusion, paternity leave has a lasting effect not only on the child, but the whole family as well. By encouraging fathers to take advantage of paternity leave, fathers can improve the development of the child, create a lasting bond between the father and child, and help the mother reduce the risk of experiencing postpartum depression. Taking no less than a couple weeks off of work for paternity leave could make the child's, father's, and mother's future much better than it would have been otherwise. Thank you.